Cardiovascular diseases are diseases that affect the normal function of the heart and blood vessel circulation. The most common cardiovascular diseases include coronary heart disease, stroke, and peripheral arterial disease. In the United States alone, heart disease is the leading cause of death, with one person dying from cardiovascular disease every 36 seconds, and 659,000 individuals die from heart diseases. Worldwide, stroke and ischemic heart disease were the leading cause of death in 2019, accounting for 8.89 million deaths. Before discussing the most common cardiovascular diseases, let's first provide an overview of the cardiovascular system and its function. The cardiovascular system is made of the heart, blood vessels, and the blood, and is responsible for the following functions. 1. Transport and supply the body's tissues and organs with oxygen, O2, and nutrients. 2. Transport hormones from secreting glands to target glands, tissues, and organs. 3. Maintain homeostasis by ensuring optimal functioning of the body, such as fluid balance and body temperature. 4. Transport of carbon dioxide and metabolic waste, which are waste products from the metabolism of cells. What is the heart and its function? The heart is a muscular organ that pumps blood carrying oxygen and nutrients to the body, while also pumping out blood carrying dioxide of carbon and metabolic waste to organs such as lungs, skin, kidneys, and bowels. The human heart is a muscle made of 3 layers of tissue: the endocardium, inner layer, myocardium, middle layer, and the epicardium, outer layer. The heart has 4 chambers known as the right atrium, left atrium, right ventricle, and left ventricle. The right and left atria receive the blood from veins, and the right and left ventricles to pump out the blood from the heart. The valve between the right atrium and the right ventricle is known as the tricuspid valve, while the one between the left atrium and the left ventricle is known as the mitral valve or cuspid valve. The contraction of the heart is known as systole, while the relaxation of the heart is known as diastole. What are arteries? Arteries are blood vessels that mainly carry oxygenated blood to organs and tissues of the body. The largest artery of the body is the aorta, which carries blood from the left ventricle of the heart. Arteries branch into smaller ones known as arterioles, or smaller arteries, which further branch into capillaries, involved in microcirculation. What are veins? Veins are blood vessels that mainly carry deoxygenated blood from organs and tissues of the heart. Examples of body veins include the cardiac veins. Like arteries, veins also have venules, smaller veins, and capillaries. Now that we have an overview on the cardiovascular system, let's discuss the most common cardiovascular diseases. 1. Coronary heart disease, CHD. Coronary heart disease, also known as coronary artery disease or ischemic heart disease, is associated with the reduction in blood supply to the heart muscle due to the thickening of the heart arteries. The thickening of the heart arteries is due to atherosclerosis. Atherosclerosis is a disease of elastic and large arteries caused by the formation of atheroma, known as plaque buildup. It is considered a chronic inflammatory as inflammation is involved in the process of atherosclerosis. An atheroma is made of macrophages, which is a type of immune cells, fibrous connective tissue, lipids, and calcium. An acute coronary event may manifest with angina, which is a feeling of chest pressure or tightness and burning, dizziness, nausea, weakness, shortness of breath, and neck pain. What are the risk factors for coronary heart disease? There are many factors that can increase the risk of coronary heart disease, including age, high blood pressure, diabetes, obesity, lack of physical activity, smoking, high levels of cholesterol in the blood, depression, and family history. 2. Stroke. A stroke is the interruption of blood supply to the brain, causing the death of brain cells. The longer is the lack of blood supply, the more damage is caused to the brain. The causes of stroke include ischemic stroke, which is due to a blockage of an artery, and hemorrhagic stroke due to the bursting of an artery causing hemorrhage. A transient ischemic attack is when the interruption of the blood supply is temporary. A stroke manifests with facial paralysis on one side, trouble speaking or understanding others, and difficulty lifting arms due to weakness and numbness. It is extremely important to call for an emergency to prevent further damage to the brain. The risk factors for stroke include hypertension or high blood pressure, diabetes, high cholesterol level in the blood, and irregular heartbeats. 3. Peripheral arterial disease. Peripheral arterial disease, PAD, is characterized by the blocking or narrowing of the blood vessels that carry blood to the legs. The narrowing or blockage of the blood vessels is associated with atherosclerosis. Due to the lack of blood supply to the legs, symptoms of peripheral arterial disease include aches or cramps when walking, known as claudication, pain, weakness, hair loss in the legs, change in skin color of the affected leg, and ulcers. Factors that can increase the risk of peripheral arterial disease include age, above 60 years, smoking, diabetes, high cholesterol level in the blood, and atherosclerosis. In conclusion, heart disease is the leading cause of death and is associated with risk factors such as diabetes, unhealthy diet, overweight and obesity, excessive alcohol use, and lack of activity and exercise. Therefore, changes in lifestyles can significantly prevent the consequence of heart diseases. If you enjoyed the video, please like, subscribe, and share for more videos like this.